All right. It looks like we've got most folks logged in and connected. Looks like we have good audio because we had a lot of great responses in our chat. Thank you all for joining us for today's webinar with NORD, which is the National Organization for Rare Diseases. I'm Lori Shogren. I'll be assisting with today's session along with a few of my colleagues. I just have a few housekeeping notes to go over before we get started. First of all, closed captioning is available for today's session. To enable closed captioning, all you have to do is click on the closed captioning button, and that's found on the bottom of your screen, and select the show subtitles option. Also, if you have any questions for the speaker, please type those into the Q&A button, and that's also found at the bottom of your screen. And we'll do our best to answer as many questions as time allows. Please just use the chat to interact amongst the other attendees and not for questions for the speaker. All right. Now I'm so grateful to introduce today's speaker, Jill Pollander, who's the Vice President of Patient Services at NORD. Welcome, Jill.
Thank you for having me.
Our pleasure.
And I just switch over my slides. There you go. Well, again, thank you to everyone for inviting me today. I'm delighted to be here with all of you. NORD's tagline is "Alone we are rare, together we are strong." And I think for those of you who are living or caregiving in the rare disease community, you truly understand the meaning of that. So a little bit about NORD. NORD was the first national nonprofit to represent all individuals, families, and caregivers affected by rare disease. It was formed by really a group of families that met around a kitchen table. And that meeting around a kitchen table became the impetus for the Orphan Drug Act, which was signed in 1983. And the signing of the Orphan Drug Act really served to put rare disease in the spotlight a bit and advance research and development for treatments for rare diseases. After the Orphan Drug Act was signed, that group of families that were meeting around the kitchen table said, there's more to be done. There's much more to be done. And NORD, the National Organization for Rare Disorders, was formed. We celebrated 40 years last year. Our mission is to improve the health and well-being of people living with rare diseases by driving advances in care, research, and policy. I tell you that because if you work in the rare space, research and development is critically important. We all want treatments, we all want cures, we all want care. But we need to put into place the infrastructure that's going to support us getting there. And that's why research, policy, and advocacy are so critically important. Organizations like NAF, who speak specifically to the rare diseases with which you are diagnosed, can speak specifically to your needs and the nuanced implications of rare for all of you. So when we talk about policy and advocacy, we're talking about policy not only at the federal level in Washington, D.C., but at the state level as well. Many state-level policies are the things that most directly impact rare diseases, whether it's equity for medical foods and durable medical equipment, whether it's Medicaid coverage across state lines. NORD has a Rare Action Network, which is our great grassroots advocacy efforts. And if you're interested in learning a bit more about that, you can learn more at NORD's website, which is rarediseases.org. NORD is also involved with rare disease advisory councils. Many states have rare disease advisory councils, and that's a great way to get involved if you want to look at a more formal way to advocate for the rare disease community. From a research standpoint, research grants for translational or clinical studies is supported by NORD. We have an I Am Rare registry platform, which is a natural history study. And in the rare disease space, these longitudinal natural history studies really are critical for study design and development. I'll skip over to education next. Our patient, family, and medical professional education is quite robust. We provide a lot of continuing medical education opportunities for healthcare providers. We also provide webinars, videos, and sort of take-along sheets that you can use to educate yourself, family members, schools, friends. And so there really are a lot of opportunities. Again, NORD's website is a great resource. NORD has two big conferences a year. Our summit is in Washington, D.C. in October, and NORD's Orphan Drug and Breakthrough Summit really puts all of the stakeholders in the rare disease space all together in one room. So, or many rooms sometimes, but it includes the FDA and the NIH. It includes pharma and biotech, advocacy organizations, support groups, research organizations. It is quite a robust conference. And our annual Living Rare, Living Stronger Patient and Family Forum, that typically is in late May, early June, and we take that all around the country. Last year we were in Los Angeles, or it's actually this year, June of 2024, we were in Los Angeles. Before that, we were in Washington, D.C., we were in Cleveland, and we were in Houston. I don't know yet where 2025 is going to be announced. And then there's patient services, near and dear to my heart. I have had the pleasure and privilege of leading NORD's Patient Services Division for the past 6.5 years. And patient services is made up of our patient assistance programs, information and resource services, and clinical trial support programs. We provide patient assistance programs for a number of specific rare diseases. We also provide patient assistance programs for caregivers, things like our Rare Caregiver Respite Program, our Rare Disease Educational Support Program. All of our programs really are designed to provide access to care and treatment. Sometimes those are disease state specific, and sometimes they're what we call rare disease agnostic, which means it spans the spectrum of rare diseases. NORD's website, rarediseases.org, is a great resource for checking what may be available and what the status of programs are that provide support. A little bit more about patient services. We have a dedicated patient services team. That's all my team does. It's a team of 25, and they staff our communications center Monday through Friday from 8:30 a.m. to 6 p.m. Eastern Time, Monday through Thursday, and 8:30 a.m. to 6 p.m. on Friday. So it's 8:30 a.m. to 7 p.m. Monday through Thursday, and 8:30 a.m. to 6 p.m. on Friday, and that is Eastern Time. We typically return calls that are left on our voicemail within one business day. We also are accessible by email, and on the website there is a contact us form. If you don't want to email us or call us directly, there is a contact us form there as well. My team is trained and dedicated to talk to patients, families, and caregivers to help you to access resources that will assist in navigating your rare disease journey. We look at providing comprehensive support. What does that mean, comprehensive support? We try to provide support really from the time of diagnosis or from the time you're trying to figure out the diagnosis to help you to access resources, to speak with your healthcare provider about clinical trials. How do you have those conversations with your healthcare provider? What does expanded access look like? And how do you have that kind of a conversation with your healthcare provider? What are financial resources that may be available? We tend to think about things like premium and copay support, free drug programs, and medical assistance for out of pocket expenses that aren't covered by insurance. But there are other needs as well. Things like travel and lodging assistance for rare disease consultations and appointments, our rare caregiver respite program, and rare disease educational support. So we've really tried to take a 360-degree view of the rare disease community on the whole. So when you look at NAF, NAF has the pleasure, if you will, or the luxury of focusing really on ataxia type diseases. What NORD is doing is looking at the rare disease community on the whole. And it's not going to be the same for everyone. Even within the ataxia community, there are different needs and different manifestations. And so looking at things on an individual level, but really trying to provide robust support. Sometimes what's needed is information. What do I do next? I was just diagnosed with this disease no one's ever heard of. Or how do I explain it to my child's school? How do I explain this to my employer? What do I do? Where do I look for services? Where do I look for care? How do I find support? And what does that look like? What can I ask for? And who do I ask? So we have a dedicated information and resource services team. Their job actually is to kind of go down that rabbit hole and find untapped resources. So, for example, I understand there's a program of support for Friedreich's ataxia, but what I need is actually who's going to provide childcare when I'm attending a clinical trial? Or how do I find support for rent, oil, heating in winter months? I'm able to manage my disease okay, but because I'm spending so much out of pocket in managing my disease, sometimes these other critical non-medical needs become a little bit more challenging. And so you can contact NORD's Information and Resource Services team. They are available at informationservices@rarediseases.org. There's also an 800 number, 800-469-0283. Or you can go right on NORD's website and you can get to us that way as well. I've put some resources here on this slide. I know that this program is being recorded, so it's something that you'll be able to refer back to. I want you to know that not only does NORD's website have robust resources, links, support, educational access, but it also has access to our state resource center. Every state's a little bit different. You might have found that. And so while there may be national resources that are available, there also may be resources that are state specific, sometimes even county specific. And so you can access those from NORD's State Resource Center. NORD, about 2 years ago, began a very robust, very rigorous program for identifying rare disease centers of excellence. Now, NORD Rare Disease Centers of Excellence are not disease state specific. These are centers that are really adept at navigating the rare disease space. We've all heard of rare disease centers that may be specific to a disease state. But what these centers do is they have services that serve the rare community. So they're outreach services, transition of care. How do you go from being a child with a rare disease, to an adolescent with a rare disease, to a young adult with a rare disease, to an older adult with a rare disease. How does that work? How does your physician, who may be a local physician, partner with a rare disease center of excellence so that a specialty, a rare disease, gets access to the best clinical practice guidelines, the best course of treatment? And your local clinician may not know all of this. And so, how do we connect them with a rare disease center of excellence so that they can get that information, so they have those resources, so they have that backup? Also, you get the best care. You can best meet your needs without always having to travel. There are things your more local healthcare provider can certainly do to monitor your care and create a plan of care that meets your everyday needs. So there's a lot going on at NORD. There's a lot going on. There are a lot of resources, and I've tried to sort of point you in the direction of some of those. That said, I envision and imagine that many of you have questions specific to you and your needs. So I'll stop here. I'll thank you for your attention, and I will let Lori see what she finds in the question and answer box.
All right. Thanks, Jill. That was so informative. And for all of you joining us, if you haven't yet checked out the NORD website and the many resources that they have on their website, I'd encourage you to do that. More new resource is that state resource that you had mentioned, Jill. And I've used that a few times myself recently, and it works really well. So I encourage everyone to check that out. The link is still up there. It doesn't look like we have any questions yet in the Q&A. Let's see.
You know, one question I'm often asked, Lori, while you're waiting, I'm often asked about when you talk about advocacy, how do you advocate for yourself? How do you sort of step up there without making your doctor or your healthcare team feel like they're being challenged? Because advocacy isn't about challenging them. It isn't about feeling like they don't know what they're doing or they're not doing the best thing for you. But ultimately, this is your journey. It is your body. It is your experience. And so asking questions, saying, looking at how you can be a partner, if you will, with your healthcare provider. Healthcare isn't about what somebody does for you. It's what you are doing with your healthcare team. So asking those questions about, is there anything else I should be asking you? Is there somebody else I should be talking to? Are there medications that I should be thinking about? Or is there a course of treatment that you're thinking about that might be appropriate for me? Or is there a course of treatment that you're thinking is not appropriate for me? And why not? I've been reading about this, or I heard this commercial, or somebody else who has the same diagnosis as me is going for this therapy. Would that be appropriate for me? Asking questions is okay. Asking questions is advocacy. Asking questions really sets you up to understand what's going on in the course of your disease process, and it's not always going to look like somebody else's. So it is okay to ask questions. And the other part of that is sometimes your healthcare provider may say, you know what? I don't know the answer to this. Great. Who should I talk to? Is there somebody that you know of that might be a good resource? Or is there another resource center? Is there another area of specialty I should be speaking with?
Absolutely. I'm glad that you brought that up, Jill. Is NORD able to help or ask questions or provide guidance on questions about insurance or government benefits?
That's a great question. In fact, it's a question that we're frequently asked. So there's a couple of different ways that NORD can assist. Typically, when you're looking at insurance or you're evaluating access to insurance, it's during an open enrollment period or during a period of time where there's been some sort of a significant change that allows you to be eligible to consider insurance. We're coming up on that. That's October. October is typically open enrollment. And there are some new things happening. For individuals who are enrolled in Medicare or Medicare Advantage plans, there's something called the Inflation Reduction Act. And the Inflation Reduction Act was signed a little over a year ago, and it started to make changes that have to do with your responsibility and your insurance company's responsibility. So for individuals who are enrolled in Medicare or Medicare Advantage or who are becoming Medicare eligible, NORD is working on some educational programs right now, which I hope to have up on the website and to have some resources up on the website very soon. But be aware that if you are in that Medicare bucket, there will be a $2,000 out-of-pocket maximum cap for prescriptions. But that's only for prescriptions. So you still will have the responsibility for your health insurance premiums, your copay costs for labs, your copay costs for physical therapy, occupational therapy, durable medical equipment, things like that. That doesn't factor into that $2,000 cap. But to know that your medications can't exceed $2,000 in a year, that may bring some relief. Another facet of that is an aspect called smoothing. Sometimes it's referred to as MP3, sometimes it's referred to as M3P, but it's basically smoothing. And what that means is that $2,000 cap, instead of you having to pay that upfront, sort of like a deductible, you can smooth that out across the calendar year so that, let's say it will cost $2,000 for your medications in 2025. Instead of paying that $2,000 upfront in January, that can be broken out into 12 equal pieces if you sign up in January. You have to sign up at the time you enroll. You cannot do that at your pharmacy. So you're going to be hearing more about the Inflation Reduction Act, smoothing, or MP3. Keep an eye out for it. It's very important. For those who are not insured through Medicare or Medicare Advantage, and you're looking at health insurance and selecting the right plan, things that you need to look at include, are your medications part of the formulary? What does that mean? It means that insurance can identify those drugs that are preferred. Typically, those are going to be generics. And so when they're generics or when they're preferred medications, even if they're not generics, your out-of-pocket costs for those medications are going to be less. When we look at rare diseases, we know very often specialty medications are prescribed. Those tend to be at higher tiers and have a higher out-of-pocket responsibility for individuals. So you want to look at where your medications fall in a formulary. Are they on formulary? What will your copay costs or coinsurance costs be for those medications? And that may drive your selection of health insurance plan if you have a choice. If you are enrolling through the marketplace, through the Affordable Care Act, healthcare.gov, things like that, you want to look at what does the plan cover? Are your medications covered? And what does that look like? How can NORD help? We are able to assist for some individuals, and I'm sort of parsing this out because some of this is in transit right now. When we have a patient assistance program for a specific rare disease, sometimes we are able to assist with the cost of health insurance premiums. Sometimes we're able to help you to navigate those challenges of picking the right plan. And that is part of the role of the Information and Resource Services team. How do we pick that right plan? How do we navigate healthcare.gov or the specific plans that I'm asked to choose between? And it's a bit of a challenge because for every single one of you on the call, the answer is going to be different. If you need assistance, reach out. We will absolutely try to help or get you connected to help. And again, that's going to be much more robust beginning in October when we encounter our open enrollment periods. Long answer, sorry.
Thanks, Jill. That's great to get a heads up on all that new information and resources that are going to be coming. We have a couple of folks that have submitted questions in the Q&A that are newly diagnosed and are wondering what they can ask for or where should they start?
It's a great question. So typically I find that when individuals are newly diagnosed, the first thing you need to do is learn as much as possible about the diagnosis. NORD has rare disease reports on the website, and those are written in a way that most people can understand. They can share the information. How do you talk to your friends about this? How do you talk to the school about this? How do you talk to your employer? And so there's a lot of information provided in those rare disease reports. Quick tip, when you go on NORD's website, rarediseases.org, there's a search bar in the upper right. I typically find if you type in the rare disease right in that box, it's going to get you where you're going faster than tooling around the website because there's a lot of information. So that's a great starting point, and then you can work from there. What else? The rare disease reports also provide information about clinical trials. It provides information about advocacy and support groups specific to your disease state. And that's a really helpful spot to start. I typically find that NORD, as the umbrella organization for 7,000 plus rare diseases, we have a lot of information. But let's be honest, if you're just diagnosed, you want to focus a little bit on your diagnosis. And so a support or advocacy organization that's focused on your rare disease is often a very good place to start. So you can get that more focused information. And then you can build out from there. You know, if you want to learn about advocacy, if you want to learn more about what goes into drug development, all of that can be found along the way. But we try to break it into pieces so that you're not overwhelmed and that you can take all of the information in a way that works for you.
That's great advice, Jill. And the National Ataxia Foundation also has a newly diagnosed fact sheet that mentions our peer support group program. So I'm glad that you mentioned peer support group programs as well, because those are very helpful and a really good place to start. Not only, as you said, learning as much as you can about the disease that you've just been diagnosed with.
I think it's really important. You know, you've been diagnosed with a rare disease. Nobody's heard of this. I want to talk to somebody who gets it, who gets me, who understands this journey. And so I think that's a fabulous resource. And I'm grateful that you have that available.
Absolutely. So Mary has another question. She's wondering, how can she find out what organizations belong to NORD?
Oh, excellent question. Thank you for that. So on the NORD website, you can type in member organizations. You can type in your disease state and it'll come up within the rare disease report. You can type in the name of a disease. You can type in the name of an organization, and that will bring you to our membership list. So you know all of the organizations and advocacy and support groups that are in fact members of NORD. There are about 370 right now.
Very nice. 370 members of NORD. Wow. And how many rare diseases are there again?
So we typically will say there's 7,000 plus rare diseases. And we phrase it that way because we know that with the advances in genetic testing, new rare diseases are being identified on a fairly regular basis. We also know that there are something called de novo mutations. So there's a first mutation. That means sometimes somebody is going to be the N of one. Somebody's going to be the first with that diagnosis. So we say there are 7,000 plus. There's some research that says there are as many as 10,000. It's probably something that we're going to see a large-scale study done on in the near future. But there's also sort of those subgroups and the genetic mutation of the genetic mutation.
Very good. So Nancy has an interesting question. She asks, does NORD have access to resources and services that NAF doesn't?
It's not about access. So if you look at, for example, the state resource guide, there's a very robust listing for all 50 states. And NAF can certainly access that. NORD has done the work, NORD has done the research to compile that. We want the rare disease community to have access to it. So it's not like we're holding something in our back pocket and we're not letting somebody have access. It's only if you go through NORD. That's not how it works. But as an umbrella organization for 7,000 plus rare diseases, there are insights and there's information that we get about the patient journey. So for example, NORD has participated in a number of patient-focused drug development meetings. We've hosted those for the FDA. So those are things that NORD, being a little bit larger and being an umbrella organization, has participated in. There are connections and there are relationships that we may have. I'm not sure, does that answer what you were looking for?
I think so, Jill. Thank you so much for that answer. Another one of our attendees is asking, is there any way that NORD can help amplify awareness about ataxia on our upcoming International Ataxia Awareness Day, which is September 25th?
Yes, send us the information and we will make sure that through social media tags and things like that, we can tag that and try to amplify that. So I'll connect you to the right people.
Sounds great. Let's see, what else do we have here? Stephen his question is, I'm being forced into Medicare and mainly highly specialized doctors who do not accept Medicare. How do I navigate continued access to these specialists?
So my question to the question is whether or not it's Medicare or Medicaid. Medicare tends to have greater access in terms of healthcare providers. And if you are Medicare eligible, you are eligible for Medicare Advantage plans within your state or zip code, which is why I'm thinking that it may be, in fact, Medicaid. And the challenge with Medicaid, and this is something we saw particularly during COVID, is the ability to sort of cross state lines or go out of a very narrow network. So there are a couple of options in those situations. The first is to appeal to Medicaid when they say to you, no, or they say you can't see this person. The phrasing you want to use is continuity of care. Because of continuity of care, you may be able to continue with a healthcare provider. The other potential, something you'd need to dig into, is in addition to Medicaid, if you are in a plan like that, is do you also have access potentially to a supplemental through the marketplace? Are you able to look at the purchase of a supplemental plan to sort of sit on top of that or sit alongside that? And that's something, if you have a caseworker, that's a really good person to work with. The person who's telling you you need to go in this lane and this is your swim lane, I would talk with them a little bit further about what other avenues may be available.
Thanks for that advice. We have another good question from Karen about mental health resources. She's asking, are counseling services offered, or do you have any suggestions on how to find a counselor to help us cope with a rare disease?
It's a great question. Again, during COVID and post-COVID, we are asked on a fairly regular basis about psychosocial and mental health services. Health insurance is not always great about it, but if you have health insurance, that would be the first stop, because you don't want to incur more costs than you need to incur either. So I would reach out to your healthcare plan, because those have expanded services. And sometimes those are online services if that's something that appeals to you. One thing that we are seeing quite a bit of is for in-person services, there's often quite a wait list or a lag time for accessing services. I'd start with your health insurer, and then I would look at some of the other online services that are available. From an affordability standpoint, those tend to be more affordable than even if you look at your local psychosocial and mental health providers. You want to be mindful of the fact that it's probably not a one and done appointment. And so how can you arrange this in a way that's going to be sustainable for you to get the healthcare and support that you need? So I would look at some of these online resources. They tend to be more accessible than the brick and mortar resources.
Thanks, Jill. All right, so we have another question from one of our attendees who says that they've had ataxia for years, but have just been diagnosed with SCA27B and is needing more and more help. Can they get a supplement for their caregiver?
The supplement for your caregiver is in part going to depend on your health insurance. Some are better than others at providing home health aides or certified nursing assistants, or even more skilled nursing support. The other thing to look at is think a little bit outside the box, not just what might be available in your home, but what might be available in your community. Are there day programs? Are there programs that you can go to where you may be able to sort of spend, let's say, half a day and get services that you need? So think a little bit outside the box. Don't just think about in the home. Think about what else might be available to you.
Absolutely. We have another question from one of our attendees who says, newly diagnosed, herself, her sister, and her brother. It seems that we keep hitting roadblocks through the medical system where we're struggling to find clinical studies, resources, or medications to provide our physicians while advocating for ourselves. It's like they're giving up on our treatment because they don't know what to do. Are there any questions that we should be asking for them to look for, or resources? And there was another similar question in the Q&A too, about how do you discuss with your physician on getting educated about your rare disease?
Those are great questions. I truly believe knowledge is power. And I don't think that means you're questioning your healthcare provider. I truly don't. I find that the NORD rare disease reports are a really good place to start. I like them because they're written in a way that it's not written for the clinician, though the clinician can learn from it. And I have a lot of patients who will print out the NORD rare disease report and bring it with them to their doctor and say, here's what I've learned from NORD. One of the really nice things about that is it talks about treatment. It talks about some of the clinical trials that are going on right now, and it talks about FDA approved medications. So it provides a little bit of a screen and a little bit of cover for your clinician. You could send it to him or her prior to your first appointment, or you can bring it to your appointment and say, I'd really like you to take a look at this. And I'd like to schedule a follow-up appointment so we can discuss some of the things I'm seeing here. I saw there's a clinical trial. I'm wondering if that might be appropriate for me. I see there's some new FDA approved medications. Why am I not on that? Or why am I on this versus that? The rare disease report talks about nutritional support and services. Can you make an appointment for me to see a nutritionist? So it's okay to use that. And it takes some of the onus off you to educate the clinician when you are providing something that is developed by experts in the field. And it's written in a way that you're going to understand the same thing that your provider is reading. They really are written in just such a way.
That's great advice. And we also have a number of fact sheets and resources on NAF's website that we encourage you all to bring to your doctor and discuss with them. Usually they'll be very open to the new information. So that's a resource as well. So Stephen has a question about how do you move an orphan rare disease into the NORD umbrella and database? And I think that maybe Stephen's asking what is the qualifications for a rare disease to be a rare disease and be considered under NORD's umbrella, perhaps.
So rare disease is any disease where there are less than 200,000 in the United States. That's the definition. In terms of the rare disease reports on NORD's website, we have a couple thousand, but I said there are 7,000 plus rare diseases. So there are not rare disease reports for all of them. We're continuously seeking subject matter experts to write, vet, review the rare disease reports. And I think what you're going to see very soon, don't tell anybody because it hasn't been released yet. We're revising the rare disease reports, and there's going to be new access on the NORD website that will provide access to a large number of additional reports. And that's coming soon. I don't have an exact date, so don't tell anybody. Shh.
Very good. So let's see. We have a question from Janet. Janet, your question is, your husband was recently diagnosed with ataxia, and he also has neuropathy in his feet. His neurologist hasn't told us much about it or what to expect. Are there different types of ataxia, doctors who specialize in ataxia, or medications that might help? Where do we start? Well, Janet, we have links on our website that talk about the different types of ataxia, the doctors who specialize in ataxia, and medications that you can talk with about your about ataxia and about symptoms like neuropathy. And we'll post those links in the chat. Thank you so much for the question. And Jill, did you have anything to add to that question?
I actually was going to suggest that your website has a plethora of information that really will help you get started on your journey. It really is a great starting point to begin the conversation, because remember, this is a partnership. The doctor isn't doing this for you or to you. He or she needs to do it with you. It needs to be a partnership. And so the more understanding that you have about what's happening and what to expect, the better able you're going to be to advocate for your husband.
Absolutely. So we have another question here. Are there any construction grants? I'm needing more and more help with my home. I live in a rural area, so the community does not know anything about what is happening to me.
So I'm going to take a little bit of a step back from that question and talk a little bit about sort of home modifications and accessibility. There are some resources out there. They tend to be very limited. They also tend to be very location specific. So I would take a look at the State Resource Center that Lori posted the link to earlier. I think that's a good starting point. Another thing you may do is if you're working specifically with a contractor in your area, they may be aware of resources and support. So you might want to reach out to them as well.
I would suggest those resources as well. And let me see, trying to find any other questions. What would you suggest for caregiver resources, Jill?
I'm pausing because I tend to get very excited about this. So when I joined NORD in 2018, I looked at all of the things that we were doing for patients and all of the patient assistance programs that we had, all of the services. And the thing that jumped out at me is, what are we doing for caregivers? How are we supporting them? So I was very fortunate in 2018 to secure the first of what's been several donations along the way to develop a rare caregiver respite program. NORD's Rare Caregiver Respite Program is designed to provide support and respite for a caregiver of a rare loved one. So significant others, family members, loved ones who are taking care of a rare disease diagnosed individual can apply to NORD for a rare caregiver respite grant. If you meet eligibility requirements, that grant provides a financial stipend so that you can hire a respite caregiver so that you can take a well-deserved break without leaving your loved one unattended or without care or unsupervised if they need that. And so it really is designed for those family members, loved ones who are full-time caregivers for somebody with a rare diagnosis. You can find access and application to the Rare Caregiver Respite Program on NORD's website, and I encourage you to reach out. The grants are available every other year, and we've had to limit it to every other year because with 7,000 plus rare diseases and the many millions of individuals diagnosed rare, there are a lot of caregivers. And we are continuously trying to fund that program and make sure that it's available for caregivers.
That's a great resource. Thanks, Jill. We have another question about SSI and Medicare. The person asking this question says that their 54-year-old brother is so close to homelessness and hunger, although he worked all of his life. And the SSI Medicare money should begin ASAP and not 2 years after applying. He can barely walk or talk. Why is there this delay? And what can be done to expedite funding after applications are made?
So it certainly sounds like he's got quite the challenge. And I really encourage you to speak with his case manager because it sounds like a very specific, very individual situation that he is encountering. And I don't know that based on the information that you've provided, can sort of dig into that, but it sounds like that is specific to his application and his case. And so absolutely reach out to the caseworker. Don't take no for an answer. If they say, well, no, or just, then ask to speak to somebody else. Let them know what your needs are. Let them know what his needs are and be his advocate.
Absolutely. I think continuing to, communicate how desperate the situation is and immediate. And sometimes you can get some financial attorneys involved. And also reach out to social workers in your area as well that may be able to help with some additional paperwork, or even your brother's physician might be able to write letters to the caseworker that Jill mentioned to also advocate on behalf of your brother, and why those benefits are needed to be expedited.
And the other resource, you're absolutely right, Lori. And the other resource may be if he has been hospitalized, the social workers and case managers within the hospital, they also may have some connections and ability to assist and provide resources. If he hasn't been hospitalized, then I'd still reach out to a local hospital and say, here's what I'm facing. Can you point me in the direction of some good resources? Where should I turn? What should I do? I don't want him to wind up in your emergency room. And how do we head that off?
Absolutely. It looks like we have a final question here. How do we get involved in advocacy initiatives related to rare diseases?
Wonderful. Thank you for that question. Go on NORD's website, look up Rare Action Network. This is a grassroots advocacy opportunity for volunteerism, for interest, for getting involved in policy, advocacy, and doing it in a way that works for you. Not everybody wants to be on Capitol Hill, but others may want to go to the State House and talk to their local legislators. Still, others may want to volunteer in another way. And so there are a lot of opportunities to get involved, to be heard, to make a difference. And so I strongly encourage you to reach out through NORD's website. Like I said, there are a lot of opportunities. And I'll look forward to seeing your volunteer activities and what you choose to do.
Absolutely. Thanks, Jill, for that response. We got a question as a follow-up to the respite care. One of the attendees that is asking, how do they locate respite care help when they're willing to pay?
Sure. So there's a couple of different things that you can do. The first stop probably is your healthcare provider, and asking your healthcare provider, do you know of someone who's providing home care services on a short-term or temporary basis? What agency do you recommend? Who shall I call? And I suggest that only because then you're going to get sort of that local recommendation as opposed to a look in the yellow pages. I'm old, yellow pages, sorry, look online. Rather than just doing a search, ask the healthcare providers that you know for a recommendation. And your first call, let's say, is to home nursing services. They might say, oh, we don't do respite care, but call so-and-so. Or when we've needed respite, we've called so-and-so. So sometimes you have to make the first call to make the second call, and sometimes it'll even be a third call. But finding a good starting point. I feel like when you've got a starting point, when you've got something to do, it gives you a direction, as opposed to feeling like you are alone or floundering. There are resources there. NAF is a fabulous resource. Use them, talk to them, look at that website. It is a robust website. NORD, we're here for you. We are walking this journey with you. So reach out. We'll help where we can. We'll try to direct you if there's not something that we have, help you to find something that will get you started to getting your answer and on the right path.
Thank you so much, Jill. This was such a wealth of information, and thank you so much for all the work that you and NORD does on behalf of the rare disease community, because it's so much and it's growing all the time. So thank you for being here. Thank you to our audience for being here. Just wanted to mention that this webinar is being recorded, and a recording of this webinar will be available on our website and NAF's YouTube channel. Any final thoughts, Jill, before we go?
I really want to thank you all for your time. I want to thank you for listening. Thank you for your advocacy for yourselves, for others, for the rare disease community. And as I said at the start, alone we are rare, together we are strong, and NORD is here for you and with you.
Absolutely. I couldn't agree more. And there's comments that are coming into the chat, Jill, just with appreciation and many thanks for today's session. So thank you so
Thank
much
you.
for being with us here today.
Thanks, everyone.
Thanks, everyone. Take care.